Good day. Today we will talk about acquired heart diseases. I am Jerry Louis Abadjes. I am a fellow of the Philippine Association of Thoracic and Cardiovascular Surgery Incorporated. The heart is roughly the size of a fish, and it is located at the superior surface of the diaphragm, to the left of midline, anterior to the vertebral column, and posterior to the sternum. As you can see, the heart has lots of parts. But as a kind of introduction, let us just mention a few for the moment, so we can follow the flow of blood and assume that this is a normal heart. Blood that goes to the superior vena cava is deoxygenated because tissues from the upper extremities and the head, among others, have used up the oxygen. This is also true with blood that drains into the inferior vena cava. They both drain to the right atrium. The right atrium then pumps blood to the right ventricle. The right ventricle contracts and sends the blood to the pulmonary artery that bifurcates into the left and right pulmonary arteries. Remember, this blood is still deoxygenated blood. The blood that reaches the right and the left lung through the respective arteries are deoxygenated. Blood is then rich in oxygen and goes back to the heart through the pulmonary veins, the right and the left, draining to the left atrium. The left atrium then pumps blood to the left ventricle. Then the left ventricle pumps blood to the aorta for distribution to the different parts of the body. Again, we will follow the flow of blood with this frontal section of the heart. Deoxygenated blood from the superior and inferior vena cava drains into the right atrium. The right atrium pumps the blood to the right ventricle through the tricuspid valve here. This valve makes sure that blood flows in one direction only. So when the right ventricle contracts, this tricuspid valve closes and this pulmonary valve opens. After the right ventricular contraction or during the diastole, the pulmonary or pulmonic valve closes, so blood does not go back again to the right ventricle. Blood goes to the lungs and goes back to the heart through the pulmonic veins, then to the left atrium. The left atrium then contracts and pumps blood to the left ventricle through the mitral valve here. Again, this valve ensures a one-direction flow of blood. Finally, the left ventricle pumps the blood to the systemic circulation through the aortic valve here at the back of the pulmonic valve. The heart continues to pump as long as we are alive. We can just imagine how pathologies to the valve, to the muscles of the heart, or the blood supply to the heart can affect the patient and ultimately the whole hemodynamics of the patient. Let's go now to some of the more common heart diseases. One of them is coronary artery disease. These are the coronary arteries, the right coronary artery and the left coronary artery. The left coronary artery further bifurcates into the left circumflex artery and left anterior descending artery. These are the blood supply to the heart. Coronary artery disease is the narrowing of these arteries as a result of plaque formation. The clinical presentation will vary according to how fast the narrowing progresses, the degree of narrowing, and which arteries are involved. Deficiency in blood supply is usually triggered by activities that increase the metabolic demand of the heart, like during exercise or when there is intense emotion. Whenever there is deficient supply of blood to any given organ, there is almost always pain. The heart is not an exception. Angina pectoris is pain brought about by coronary artery disease. It is caused by deficient blood supply compared to demand. This is substernal and may radiate to the left upper extremity, neck, or epigastrium. This will last 5 to 10 minutes and this is relieved by rest and or with nitroglycerin. Another manifestation of coronary artery disease is myocardial infarction. Ah, Myocardial infarction happens when ischemia leads to myocardial necrosis. The clinical manifestation can be as severe as to cause ventricular septal rupture. This is the septum and a defect may result from myocardial infarction here. Or it can affect the papillary muscles here, then cause tethering of the valve and failure of the mitral valve to close properly on contraction of the left ventricle. Thus blood goes back to the left atrium here. Then there are other sequelae such as arrhythmias, like ventricular tachycardia that can cause death. ECG may show ST segment elevation, ST segment depression, T-wave inversion in patients with myocardial infarction or ischemia, but may be normal even in patients with coronary artery disease when the chest pain has disappeared and after the patient has rested. The serum cardiac markers will also appear only when there is cardiac or myocardial infarction. Echocardiography can show segmental or global wall motion abnormalities or depression in the contractility of the heart owing to myocardial ischemia, but this can be normal even in patients with coronary artery disease. When patients show normal ECG or echocardiography, the physician can induce ischemia by stress echocardiography, either medically or making the patient do exercise, such as this one. Coronary angiography is a primary diagnostic tool for coronary artery disease. A catheter is inserted to the radial artery or the femoral artery and threaded to the aortic root, and dye is injected to the right and left coronary arteries. Management of coronary artery diseases starts with optimal medical management. There are indications for percutaneous catheter interventions where angioplasty is done. And for more severe cases, we do coronary artery bypass grafting. We can use the left internal thoracic artery that is a branch of the subclavian artery, or we can use the greater saphenous vein as graft. The grafts are anastomosed to the coronary artery to bypass stenotic parts. And for the saphenous vein, we anastomose the proximal part of it to the ascending aorta. Depending on the patient, we can do bypass grafting from just one graft or to as many as 6 to 7 grafts. This is the end of part 1 of acquired heart diseases. This lecture will provide a framework of our understanding of the diseases. You have to go back to Swartz, however, for a more detailed study on the subject. Thank you and have a good day.